As people age, their cognitive abilities decline. Now, you might be worried about this for yourself or for a loved one. But what is normal and what isn't? Everyone loses their keys or their wallet from time to time, or can't recall the name of the book they just finished reading and they're trying to recommend it to a friend. But how can you tell when you've crossed the line from normal forgetfulness into the frightening spiral of dementia? While recognizing full-blown dementia is obvious, distinguishing the early signs of dementia from normal aging is trickier than you might think. Dementia, by its very definition, refers to a decline in cognitive function beyond what's expected in normal aging. Contrary to popular belief, dementia and memory loss are not a part of the normal aging process. Dementia is disabling. It's a loss of essential intellectual abilities like language and memory and judgment and thinking. For example, it's normal to forget where you put your keys, but it's not normal to forget what keys are for. You might forget a word that's on the tip of your tongue, but you shouldn't forget what you just said in a conversation and begin to repeat yourself all over again. It may be hard to teach an old dog new tricks, as the saying goes, but you shouldn't have trouble with things you've done many times before, such as get dressed in the right type of clothes. And you shouldn't get lost or disoriented in your own neighborhood. People with dementia lack judgment and they make poor choices. The person who counted every penny is suddenly spending wildly on extravagances. Dementia affects everyone differently, so a person may have some of these changes, but not others. Now, full-blown dementia isn't difficult to detect, but how can you tell if you or a loved one is moving toward dementia? This is the tricky part. The condition is called mild cognitive impairment, or MCI, and it's a middle stage between normal forgetfulness and true dementia. There's no strict line between MCI and normal aging. It comes down to a matter of degree. Losing your keys some of the time is normal. Losing them all of the time is not. It's okay to have forgotten the name of that great book, but forgetting the name of your spouse or your best friend, that's a concern. The symptoms of dementia can usually be detected by people you meet, even strangers. But with mild cognitive impairment, it's likely that only you or those you know well would notice. Remember, dementia is debilitating. With mild cognitive impairment, you can generally still function independently and go about your daily life. Does having MCI mean that you'll for sure get dementia? Not necessarily. Mild cognitive impairment is a major risk factor for dementia, and something like 10% of patients with MCI progress to having full-on dementia. But it's also possible to remain stable and even to get better. Because MCI is difficult to pin down, this is an active area of research, and we're going to talk more about that in the next videos.